announce an important medical milestone. We have successfully performed balloon-assisted basilica with TAVI procedure on a 70 years elderly woman with symptomatic severe aortic stenosis and multiple comorbidities. It's a rare innovation and highly advanced cardiac intervention that opens new doors of treatment for patients with severe aortic valve disease. As we all know, aortic valve is the most important wall of our heart, through which the blood flows from heart and supplies blood to the entire body and organs from head to toe. Diseases of this wall, that is severe aortic valve narrowing or aortic valve stenosis, is a life-threatening condition, especially in elderly patients. Traditionally, open heart surgery, that is surgical aortic valve replacement, was the only option. But many patients are too high risk to tolerate such a major procedure. That's where transcatheter aortic valve implantation or replacement has emerged as a revolutionary, minimally invasive alternative. It allows us to implant a new valve through a small puncture in the leg artery without opening the chest. Recently, we have performed a very rare and advanced version of this procedure, a balloon-assisted basilica with TAVI. Our patient was a 70 years elderly woman with history of hypertension, hypothyroidism, COPD, obstructive sleep apnea and obesity. These all were the risk factors associated for the patient. So she had presented to me with chest pain and progressive shortness of breath on exertion. On detailed evaluation, she was diagnosed to have severe aortic stenosis. We had discussed surgical open heart aortic valve replacement surgery, but she had high estimated risk of morbidity and mortality for an open heart surgery. Considering overall risk and recovery time, patient and her family preferred a minimally invasive procedure rather than an open heart aortic valve replacement, and hence she was planned for minimally invasive TAVI procedure with more safety and short recovery period. To perform this procedure, along with me, we had Dr. Suraj Narasimhan, an interventional cardiologist from Bangalore as a proctor. On further evaluation with CT scan, TAVI protocol and premenstrual analysis, her structural anatomy had further added a layer of complexity in an already high-risk patient. She had low-lying left main coronary artery. The artery that supplies maximum blood to the heart was unusually lying very close to the native aortic valve and also had narrow sinus of Valsalva and calcified valve leaflets, all of which increases the chances of coronary artery obstruction during routine TAVI procedure. Hence, we have decided to perform balloon-assisted basilica technique followed by TAVI to reduce the risk of coronary obstruction. Basilica stands for bioprosthetic or native aortic scallop intentional laceration to prevent iatrogenic coronary artery obstruction. In simple language, basilica means we carefully split the old valve leaflet or damaged valve leaflet so that when the new valve is placed, the heart arteries remain open and blood flow is not blocked. We have performed this procedure using electric guide wires and balloon dilatation to intentionally split or tear and wide open the damaged valve leaflet and then placed medial myvalve in aortic valve position. And believe me, this entire procedure was successfully performed without any major complications from leg, just through a small keyhole without an external stitches. Our patient was mobilized, that is, she was moving around on next day of procedure and safely discharged on fourth day of the procedure. So basically, TAVR or TAVI is a minimally invasive procedure with faster recovery, lower risk and safe procedure for high-risk patients. This is not just a medical success, but a regional milestone. This is one of the rare procedures of its kind performed in India and globally. By bringing it here, we have opened hope for patients who were earlier considered too risky and would have no safe treatment options. Medicine is about hope and innovation. With this procedure, we have shown that Even the toughest challenges in cardiology can be solved with teamwork, technology and compassion. This is a proud moment for our hospital, our team and most important, our patients.